Rotary is an organization of business and professional persons united worldwide who provide humanitarian service, encourage high ethical standards in all vocations, and help build goodwill and peace in all the world.
So when a 12-year-old girl is born into poverty, people start to view her at that point as a woman. So now when she goes to school, she's subject to violent sexual assault, so she stays home. And she begins a cycle of, turning 14 and being married. At 15, she's pregnant. And the course of her life changes, and that's repeated year after year after year in generations. But there are solutions. The Malawi Girls on the Move School was built in Eastern Africa in order to provide education for rural girls. And it was started by Christy Johnson, who's a Canadian teacher, and Memory Chaziza, who's a Malawian teacher and also an orphan. And the Rotary Clubs of Lethbridge have been great supporters of Malawi Girls on the Move. We have 4 students that we're supporting on scholarships through the program. We helped to build their cafeteria, so now 320 students are eating all together and they're not eating on dirt floors in the dark. And now our final project under construction right now is a staff duplex, so we can attract the best teachers, which will allow them to be self-sustaining by 2018. And so the question I always ask is, if you could change a girl's life forever, would you?
The Rotary Club of Lethbridge is working with Uphill Both Ways Education and Relief Fund on a project to bring education to primary school in rural district of Nepal. The project is involving the tearing down of an existing school that's basically falling apart and building an 8-classroom school that'll provide education for approximately 150 to 200 students by the time we're done. The area is in extreme need of education. The children there have no resources available to them, no pencils, no pens, no paper, no books, but there is an incredible desire to learn there. The kids will walk up to an hour just to reach school and be there with smiling faces and a need and a desire to be educated.
This year, the Rotary Clubs of Lethbridge are very pleased to be supporting the new Community Arts Centre. This is a project that will encompass all seasons and all people. Rotary will be contributing to the construction of the outdoor patio that'll be located on the southeast corner of the facility. This patio will add enhancements to the community by adding artisan benches, promotional banners, room for artisan market facilities, as well as also proposed that it'll also hold a projector with climate control, audio capabilities to hold outdoor festivals so that all of the community can enjoy.
Let me tell you about St. John's Haven. It's a St. Michael's Hospital project together with the City of Lethbridge and a number of others, and it's going to be a multi-million-dollar facility with 40 medical suites intended for a marginalized population that we have in the city and area. Probably the best way to describe the project is to describe who it typically would serve. The individuals that would be housed in the project would probably be mentally challenged or mentally ill. They would be ones that aren't adequately served elsewhere or on the street, that'd be medically in need, probably an older part of our population. It's a facility that's very much needed. And quite frankly, I'm hoping that we can pull together all the funding that's needed in order to bring it to success.
As a young doctor, and coming from my first year of practice, I descended upon Brooks, Alberta, in the midst of the worst epidemic we've ever of poliomyelitis. In those days it was called infantile paralysis because it particularly affected children under 5. But this was the worst epidemic that they'd had in many, many years. Over 1,000 people died in Alberta. Many more were crippled, and the panic and fear of the disease you could almost cut with a knife. As a young doctor, we were helpless. We didn't know what would cause the disease. There were some suspicions, none of which were true. We had no treatment, and all we could tell parents when they brought their child in or themselves with a muscle ache or a headache is that we don't think it's polio, but it could turn out to be that way. And of course, nobody was satisfied by that answer, and I think they expected more of us. Whenever you ask me to discuss Rotary, I have to talk about the Polio Plus program. I feel it has been such a benefit to the world, and in effect has almost eradicated this scourge. Every Rotarian should feel very proud of what we have done for the world, in conjunction with the World Health Organization and other organizations, and feel that if this, to me, has been the greatest accomplishment since I've been in Rotary, and I'm very proud of the fact I'm a Rotarian.